Hi, everyone, and welcome to the webinar. I am Sandra Whitehead. I am the current president of SOPHIA, and it's my pleasure to welcome you this afternoon and to welcome our speaker, Christine Ortiz Gumina. Thank you so much for joining our webinar on using health and all policies approach to enhance public health preparedness. So if you're not familiar with SOPHIA, we're so happy that you found us. SOPHIA is an association of organizations and individuals that are focused on improving and promoting the fields of health and all policies and health impact assessment. And we develop high quality resources, build capacity, and support members through networking and mentoring opportunities. And we do great webinars like this on issues surrounding health and all policies and health impact assessment. As I said, I'm Sandra Whitehead. I'm the current president of SOPHIA. And just a little bit about me. My background is in public administration and public policy. I've worked as a local government planner, and I've worked in public health at the intersection of health and the built environment for the last 20 years. My expertise has been developed over that time in health and all policies and using all the tools of health and all policies to promote community health and equity. I've also worked at several national nonprofits you may have heard of, NACHO, the National Association of County and City Health Officials, and HiAP, where Christine and I work together, which is the National Environmental Health Association, where I was the director of programs. I have a current role at George Washington University. I'm the chair of the planning department there and an assistant professor. And I'm also a member of the National Environmental Justice Advisory Council. And in that role, I work on a lot of integration of health into EPA regulatory policy. And now I'm going to turn it to my co-presenter to introduce herself.
Hello, everyone. Good evening, good afternoon, or good morning, depending on what side of the coast you're on. My name is Christine Ortiz Gumina. I am the Associate Director for the Climate and Crisis Preparedness portfolio at the National Network of Public Health Institutes. As Sandra mentioned, we're paths collided at the National Environmental Health Association. My background is in environmental health. I started my career at a local health department serving as an environmental health specialist, and went to NEHA and worked at the national level of environmental health, working at the intersection of climate, environmental health, and preparedness. And I joined NMPHI about 3 years ago, working on various projects in infection prevention control, disaster mortality, areas of climate, and border and rural health. So with that, I will pass back to Sandra.
Thanks, Christine. We're so happy to have you today. So we want to know a little bit more about you as the audience. So we have some questions that we'd love for you to answer for us through the chat, since we are a larger group. We had originally thought that we might be able to just have people do shout outs, but I think we're a little bit bigger of a group. So right in the chat, where are you located? And Christine and I will shout out and see. So I'm in Washington, D.C. Oh, we have folks from Quebec, Washington State, Mississippi, Arkansas. Wow, all over the U.S., Kansas City. Welcome, everybody. Iowa City. Where are you today? Are you in Jacksonville, Christine?
I am in Jacksonville, so I currently reside in Northeast Florida.
Oh, we have someone from Ghana. Wow, that's a big audience. Another Quebec. This is great, you guys. We're so happy that you were able to join us. You know, we find that preparedness, and especially using a health lens to preparedness, really is not a national issue, right? Like, this is something that is useful frame for all of us, no matter where we're located. So I want to know, like, which sector do you work in? Are you in the private sector? Do you work for a corporation? Are you at a health department? Do you work for a governmental or a nonprofit entity? Let's see who's here from different sectors. So I'm currently working in the academic sector, public health, government, university, governmental contracting,
A lot of health
good
department folks
state.
on the call too.
Fabulous. That's awesome. And as Christine and I mentioned, we both have health department experience in the environmental health sector. And I worked at the intersection of environmental health and chronic disease for years when I was at the state health office in Florida as well. And then, so what level? Are you at the national, tribal, community level? I think some of that was in your previous answers, but we're just trying to get a sense of who found this interesting, who, who's the audience. County, lots of counties, some students, yay. So glad to have you. All right. Regional level, that's very important, right? Because especially preparedness and disaster preparedness should be regional, right? You can't do it in isolation in one jurisdiction. National level, great. Thanks for playing along, you guys. This is really helpful to us as we frame our remarks. And then I think this is probably the big question. What attracted you to this topic? Why are you interested in the intersection of health and all policies and preparedness? One of the reasons we're asking this question is we want to know if there's a need for more tools in this area. This is the very first tool that's been created around health and all policies and the intersection of preparedness. And so we would love to know like what your other needs are and other resources that SOPHIA can develop to help you with your practice.
Sandra, I see in the chat
Great.
leadership development and mental health.
Mm. Uh-oh.
Environment in all policies, including the healthcare center or sector.
Yeah, really a good mix of folks moving towards a health and all policy. So we'll talk about that. We'll talk about how the tool can be used. Good. So first, I want to give you a little bit of background on this tool, how it came about, why it was created, and then we're going to talk about the sort of the intersection of health and all policies and preparedness. And then Christine's going to go through the tool and talk about how it can be used itself. And then towards the end, we've left a lot of time for us to have conversations about the tool, about your needs in the field, and about how this could be helpful to you. So back about 3 or 4 years ago, when Christine and I were both still at the National Environmental Health Association, we had been working on health and all policy guides on different areas. A big one that we spent a lot of time working on was health and all policies applied to lead poisoning prevention. The CDC, through our grant that we had with them, invested some capacity building in that area, and we worked with several jurisdictions. I think there were 9 jurisdictions that we did pilot projects on with our partners at NACCHO and ASTO. And the strategy from CDC to spread health and all policies practice has really been to connect it to the different sectors, right? To connect this HiAP framework to different sectors of public health work, because they're all about building capacity within the public health workforce, which it sounds like a lot of you are. And so we had this big initiative for a couple of years around lead poisoning prevention. We did some pilot projects and we learned from those. And the CDC has since launched some pilots around climate and HiAP and using a climate, using a HiAP lens for climate. But whenever we talked about doing that at NEHA, it seemed like that space was really crowded. And so we said, well, what about climate as a preparedness issue? Because it is, right? It's a mitigation issue. It's a right, every part of the preparedness cycle is involved with climate. And so we decided that because is essential, then we decided that we would go with the preparedness space. But more than that, too, since this tool has been created, there has been this approach embraced by the new administration. Not so new now; we're 3 years in, but one of the very first executive orders that the Biden-Harris administration put out was this whole of government approach to climate. Right. And whole of government, if you aren't familiar with the health and all policies buzzwords, whole of government is what health and all policies was first called whenever it was adopted by the WHO back in the late 90s. This whole of government approach where people across the entire government are working towards one goal, right? And that's really kind of this health and all policies lens of you're pulling together people from these disparate parts of your organization or your community that are working towards the goal of health. And whatever health means in your community and your circumstance. And then this was reinforced by another one of his executive orders, which you probably don't know by number, but I bet you've heard about Justice 40. Justice 40 says that 40% of all benefits from the federal government should flow into communities that are identified as disadvantaged. And at first, this one only applied to 3 agencies, to HUD, EPA, and DOT, US DOT. And it's since been expanded to all federal agencies so that there's this focus in on not just everybody working together across sectors, but also everybody working together to target resources to prepare communities that have been underserved and to get them included and at the table. And then the last executive order that I'll talk about is 14091, which addresses racial disparities by removing barriers to equity and decision making. And this is the expansion of Justice 40 to all of the other agencies, but it also provides a framework of thinking about these issues as larger systemic issues of decision making, right? That influences our ability to be prepared and our resources that we get for preparedness. So I wanted to give you this kind of a federal framework that's supporting moving towards a health and all policies lens. And of course, public health is preparedness and vice versa. Christine's done a lot of research around connecting this, and I'm going to turn it to her to talk about this slide.
Thanks, Sandra. So like Sandra said, public health is preparedness. And we hear this all the time. Many of us within public health express this. However, there are still silos between emergency management and public health. And the pandemic, the climate disasters we've experienced the last couple of years, the man-made disasters we've experienced in the last couple of years have pretty much shown the lack of symbiotic relationship that public health has with emergency management. And in my high-level review that I've done of emergency management academic programs here in the United States, what I often find is that public health is an elective course or it's a one-and-done course in a master's program for emergency management. And public health is really not centered or part of the main focus of the emergency management curriculum. So what does that mean? If we have our emergency managers not thinking in the mindset of public health, are they getting that training once they get into the workforce? And they're probably not. So is this an opportunity for public health to collaborate better with emergency management and provide opportunities to educate both workforces on the skills and the knowledge that each other have in order to better improve response and preparedness? What's the role of environmental health? Monday was the anniversary of 9/11. We all saw the advocacy work around healthcare and providing healthcare services to those responders. But what if environmental health was at the table when those plans were created prior to 9/11? What if there was someone that said, this is what you could be exposed to in the buildings. This is the PPE that you need to wear in order to go into those buildings and safely reduce the amount of harm afterwards. And we still haven't really moved that needle since 9/11. There's still not a lot of information provided to first responders about potential hazards that they can experience when they are responding to a disaster. The opioid epidemic is an example of this. We have first responders that have the knowledge that the area could be contaminated, but what about environmental health when they're going to a restaurant or when they're going into a hotel? What are the contaminants that they can be exposed to? So again, another opportunity for EH and EM to work with each other and avoid future exposures. Subject matter expertise. Public health and environmental health has this really unique training rooted in science, and they can serve and support and create, information and resources around water contamination, food, vector-borne diseases, building hazards like mold and chemical ash, and really provide that guidance in order to reopen buildings, reopen schools, reopen healthcare facilities. Horizon scanning. What is horizon scanning? For me, it's forensic guessing. And what I mean by that is using all types of data, using the news, using your reputable colleagues in order to potentially predict negative future events. And a current example of this is Chagas. We have a large group of people moving from the south border to other areas. We've had an abnormally warm summer. What does that mean in the future? What if we have an abnormally warm winter? What is that going to look like for Chagas disease? Malaria. We're having, one or two cases of malaria here in Florida. What does that mean? Is malaria going to be endemic in the United States again? And it's not to create a fear, but it's to also just think about what could potentially happen and how can we better protect the community in case this does come into the community. And then finally, needs assessments. These could be done at rapid and high levels to provide information for something within 3 months. They also could be done long-term and look at sustainability. So this is way how public health is preparedness. Sandra, I'll send it back to you.
Yeah, and I think if you're interested in this, having this conversation, anyone in the audience, we're thinking about convening a conversation around this and what are the needs. So we'll share our contact information at the end, and we want to put you on our mailing list because we think that this is very central, right? Because so many times emergency preparedness is over here, and environmental health might not even be integrated into the health department. In some states, it's way over in another building, or it's not even a part of the way the health department is funded. And so making sure that we're building these bridges and that there's this cross training and this cross disciplinary interest is part of this health and all policies lens that we really wanted to bring to this conversation. But so what is health and all policies, right? Like we've been talking about health and all policies, like you already know what it is. And I want to make sure that I cover this because you might know or you might think you know, right? But this is the formal definition, right? It's this approach to policies across sectors that's really thinking about it systematically and in a very larger scale, right? You're thinking about the relationships across systems. That's what I mean by systematically, and looking at the health implications of decisions, primarily policy decisions, but also small, like little p policy, like big policies, like health, like complete streets or, our emergency management plan, right? Those are big P policies, but also small p policies, thinking about your procedures, right? How do you communicate with your partners? What are your processes to make sure that the right people are at the table, and that that you're including the people who not only need to be there, but who should be paid to be there, right? And making sure that as you're connecting these resources in a health and all policies lens, you're also looking for synergies for, there are things that you at the health department can't do, for instance, around communication, that your partners can do, right? There's things that I couldn't say as a health department person working for the state of Florida Health Department about climate change that my partners at the South Florida Regional Compact could say about health and climate, right? Like, so these kind of synergies where, um, because we can't, from health department especially, or a public place, we can't do everything for everybody around this issue. We need to find where our partners can contribute resources, and we can leverage those resources. One of the strategies of health and all policies is really leveraging partnerships and bringing new resources to bear on the problem. And of course, the ultimate goal of health and all policies is to avoid harmful impacts that might occur from these policies, right? So you're looking at things in the future, not things that already occurred, because we can try to fix those, but looking towards the future with a health and all policies lens of avoiding harmful impacts, and to make sure that we're not doing more harm to people might already be harmed, but also making sure that we can amplify positive impacts, which I think is a little bit different than some of the assessment tools that are out there. But remember, health and all policies is this framework that these assessment tools live in. Do any of you, this is another chat question, do any of you have direct experience with health and all policies? I mean, you might be doing it, but not necessarily calling it that. um, Working across sectors, building cross-sector partnerships, leveraging data from other sectors. Let's see. I want to give a minute for people to type in the chat. Maybe my chat's not updating. Christine, can you see it?
See the chat, but no one yet.
Oh, okay. We'll let people think about that, right? Because you might not be sure. Sometimes health and all policies is called livability. Sometimes it's called quality of life. It's more how you approach it. So we'll just move on. I mentioned the 7 strategies of health and all policies, and this is directly from the guide. This these 7 strategies came from an article by Lauren Gase back in 2014. And there have been some updates to these strategies where people have collapsed them or put them together. But I find the 7 strategies to be very clear, and a good way to think about health and all policies, right? Like, so what we really think of when people say they're doing health and all policies is this cross-sector collaboration, right? As a planner, I'm working with the health department, I'm working with my preparedness folks, I'm working with people in the community on preparedness plans, right? Things like that. I'm working across sectors. And incorporating health into decision making, sometimes people are doing this and they say, we're doing health and all policies. We're doing this one thing where we are working with a health lens to get health put into other plans in our community around water, around um, uh, thinking about how we are managing our assets in our community, right? So incorporating a health into decisions as a normal routine. Maybe you're doing a health impact assessment, or you're, in some other way using a health matrix. And then enhancing workforce capacity to identify health outcomes and to influence those through policy. So working doing exercises like you do, right, in preparedness, making sure that everybody is not just exercised, but understands that the relationships that you have outside of those exercises and outside of the rooms where you're doing the planning are just as important, and making sure that everyone has the proper training and guidance that they need. And then, of course, coordinating funding and investment. We all know that sometimes there's a lot of emergency preparedness money and sometimes there's not. So making sure that you understand like how to develop contracts that spread money to your backbone organization, that during mitigation and recovery, that there's an investment in rebuilding and revitalization so that the resources are distributed equitably across the partners who need to be included, and including paying community groups for their participation, volunteers. And then integrating research, evaluation, and data systems. This is about the kinds of data that you bring to your decision making. Instead of just pulling health data or just pulling economic data, you're also looking at social vulnerability index and some of the other tools that emergency preparedness professionals are very good at using, right? The first social vulnerability index was done for preparedness purposes, but making sure that you're also using health data and bringing that to bear through tools like health notes or health impact assessment. And I talked about synchronizing communication and messaging. There are some things that as a health professional or public person that you can't say that your partners can, but also you want to make sure in time of emergency that you are getting the message out clearly and succinctly and transparently to as many people as fast as possible around boil water notices, around shelters and pods, and where the resources are, where the food is, right? And then implementing accountability measures, making sure that you're coordinating not just the responsibility for everything that you're doing, but for the evaluation, for the process, and that you're always thinking about a process, a continuous process improvement, right, through your accountability and your performance measures. So making sure that you are creating those with your partners. And then, one of the main reasons that we wanted to create this tool around preparedness really is so that this framework can be used to make sure, it's a tool, right? This framework is a tool for professionals to be able to say, okay, well, we've done this part, we've done this part. How are we injecting a health lens into our work while the outcomes of community safety and recovery are ultimately health outcomes, making sure that we're focusing on these broader policies and practices to deepen our partnerships and engage our community are important. And now I'm going to turn it over to Christine to talk about the disaster cycle and the tool itself.
Thanks, Sandra. So when you go and look at the guide, you'll notice the structure of the guide. And we were very strategic in how we laid out this guide. And we first started with the 7 strategies of HiAP that Sandra just described. A lot of that is because many people are not familiar with HiAP. And so starting with that kind of set a baseline for folks using the tool and first understanding what is it, maybe I've already done it, and kind of just thinking through that process. From there, we move on to this table, which is the disaster management cycle. And you see the 4 different phases of the cycle along with the strategies of HiAP in there. And the check marks are kind of like the overlapping points between the two. We moved and used the disaster management cycle mostly because it's another baseline point. It's some folks at a health department may be familiar with it. Some may have never been part of a disaster or preparedness plan. So again, it was kind of creating that baseline moment of getting folks to think about what have I done in preparedness and what have I done that is HiAP, and how they both correspond to each other and overlap. So going from there, we move on to each of the each of the four parts of the management cycle, into a little bit more detail, giving examples, showing case studies. And I'll go into that here in a second. But a variety of reasons of why we decided to do this way is that sometimes you may be really lucky and have a large staff. Sometimes you may have a staff of one. So really thinking through on how to best use your people assets and what they are competent in, what they can provide context in, and also to prevent burnout. I think this is something we're very much familiar with the last couple of years, that we have been going through periods of multi-disaster and disaster fatigue. And so if you already have that laid out, and you already have that planned out, and you already know the folks that can kind of do different parts of this, then that hopefully in practice will reduce some of that burnout. Also, additionally, in slides following the management cycle, we have lists of partnerships. Some are partnerships that we probably are familiar with, like our healthcare, our police department, maybe fire management, but there's also a list of partnerships that we may not be familiar with and how we can engage them. You could use that list to maybe start looking at your Rolodex and thinking about people that you already know in each category. It could also point out maybe gaps that you have in your list and who you can think about, or maybe who you need to start reaching out. Are there folks in academia and you need to reach out to? Are there more community-based organizations that maybe could provide funding or food or shelter? So that's kind of our thought process as we laid out this guide. As we first started with HiAP, what is it, to get people thinking about that. Then we moved into the disaster management cycle, so you can see those overlaps, give a little bit more detail about each phase of the cycle, provide some case studies, and then give some examples of list of potential partnerships that you can make in the future. Next slide, please. So the first phase of the disaster management is the mitigation phase. And the mitigation phase is your pre-disaster. You're aiming to prevent or minimize the impacts of future disasters. You're doing your planning, your risk reductions, you're assessing your buildings and your hard assets along with your people assets. How many volunteers do you potentially have? What are they trained in? What do they need training in? That's what you're looking at this time. You're also conducting probably community needs assessments. Is this community near a shelter? Can we use their school as a shelter, or is their school not in appropriate condition for a shelter? What if this is a long-term event? What if we can no longer use this school as a shelter? What if we need to start thinking about long-term shelters? Is there a motel nearby the community that could be impacted? How can we convert that motel into a long-term shelter? So that's some of the things that you're thinking about with the needs assessment. Also, areas that could be impacted for first responders. Is there a bridge? Does this area frequently flood? What if the fire and the wind changes directions? What are alternate evacuation routes? So your needs assessment is going to look at your physical assets. You're going to look at the training capacity of your emergency management, your public health, where are those gaps, how we can provide training in those areas. You're going to look at your limitation and capacity through your needs assessment. Now, it's really hard to convince policymakers, and again, not preaching to the choir, about how to spend money on future risks. But it is cost effective, and we're seeing it more and more with these disasters that we're in the billions, not millions anymore. We're in several billions now, and they're happening alongside with other health disasters. Financial institutions can help here. This is a time for you to make those relationships with your community banks. They're part of the community. They don't want to lose people, because then they lose people who are putting money into the bank. So maybe they might provide some support in providing funds for a food bank, or providing funds for people to relocate in order to evacuate. You won't know until you ask. So knowing your community banks, knowing your national banks, knowing other means of funding. So what are the state and federal funding support when you have a disaster, and having that list of those programs. That's, you know, your collection of your information that you're doing during the mitigation phase. Community engagement is really important at this time too. You're educating the community for the risk. I live in Florida. Flood insurance and disaster insurance is becoming sparse. So people need to know that information. Go to the local library, teach your community on how to use the EPA risk tools or any other risk tools that are there. I'm sure they'll be at the next city planning event if they know what their risks are. Take that time to go to the local church and ask the pastor, hey, can I have 10 minutes after, Sunday to show people these are the environmental justice risks that you're at. This is the exposure risk that you could be at risk if flooding happens. You live next to this factory, or you live next to the storage facility. So the mitigation phase is your collection of information. What does the lay of the land look like? Who are our current partners? Who are we missing? And what training do we need? Next slide, please. The preparedness phase, this is like your active training phase. You're training your MRC. You are creating your response plans that are based in the data that you've collected through the mitigation phase. You're doing evaluations to that. If this is not working, how do we create an alternate solution to that? You're educating the community. The commercials that you have about we're now entering hurricane season, or we're entering fire season. This is what you need in order to make a prep bag. Giving folks pamphlets on how to make a prep bag at the dollar store. You see it all the time that the commercials show you all these things, and then you go to Amazon and the prep bag will end up costing you like $50. But can I use an old backpack? Can I get things from the dollar store? Just making these lists and letting people what they can get at their 7-Eleven, that is helpful to them when they have to evacuate. You should have your Rolodex of experts that you could pull from and start incorporating and having as part of a work group to build out your plan. So that is what you're doing in the preparedness phase. You're doing tabletop exercises between emergency management, your public health, your healthcare, your city or your state governance. We're all familiar with tabletop exercises and making those plans. So at this time, you're pulling in those resources. And then during this phase, again, financial, how is finance going to help rebuild and support evacuations? You're making sure your shelters are ready to go, that they have the supplies that they need, that the codes are up, they're up to code to be a shelter. Maybe something happened throughout the year and that elementary school is no longer a viable source. So what other facility can you use for a shelter? Knowing your NGOs and knowing your community-based organizations. Are there retired military in your community? Are there retired nurses that can support any healthcare needs? Retired firefighter or organizations that are supporting, that could also be part of the response phase. What community-based organizations are, food services? Do they have the proper training and the supplies in order to be an appropriate food service? What are national and international organizations as well? Because you don't know what the impact could be. It could be a whole state impact. So what are local states that you could reach out to for resources? So again, that's here in the preparedness phase. You're actively putting your plans together, you're practicing your plans, and you're, again, doing an evaluation of what your gaps are, what your needs are. Next slide, please. The response phase. This is right after the disaster. The disaster occurs, you're responding. And here you want communication to be clear, you want it to be concise. You don't want to confuse the public during this time. And that's why the collaborations, the partnerships, having these cross-sector work groups can help build a more synchronized message when you're giving it to the public, so there is not confusion. HiAP can be employed and can be really helpful during this part of the disaster phase with communication and coordination. Communication, you need to think outside the box sometimes with communication, depending on what you've lost in communication or what the public responds to in communication. Again, evaluate, are you reaching the people you need to reach out to? Is what you're sending out getting to those folks? And if it's not, then you got to be creative. You got to think outside the box on how you're going to communicate. I remember when the 2017 hurricanes happened, and in USVI, one of the ways that they communicated with people was that on the weekends, everyone would go to the local outdoor movie theater to go watch movies. And so they used that time to communicate, you know, what was available, when were you going to get your power back, food services, all that stuff. So think about your community, think about where they go to for their information, and you know, again, continuously evaluate how to better reach them. You're assessing the status, the health status of the community during this time. If a fire happens and the winds shift, what other communities can be impacted? How do you get those people moving really quickly? And this time is also really challenging because you often have political figures who want to be the hero. And public health does not train you on how to be a politician. It does not train you on how to work with politicians sometimes and communicate with politicians. And we can have the best plans. We've worked out these plans all the time. And, you know, without fail, there will always be someone who, you know, wants to be a hero. And when you have cross-sector multidisciplinary teams, you can reduce that, because if you have different people coming together and providing very sound solutions, then you could probably, hopefully, and possibly reduce the likelihood of that politician wanting to come up with, you know, the crazy scheme that they think of at that moment. So the response phase is really critical when it comes to communication and coordination, and HiAP can be used in order to synchronize that messaging and communication, and, you know, constantly evaluate your communication. Next slide, please. Lastly, the recovery phase, and public health's role should be forefront and at center during the recovery phase. Yes, you're going to have your hot washes, you're going to have your after action reports, you're going to analyze your gaps, areas of improvement, and unforeseen barriers that were caused during the disaster. It's very important, and it should be communicated with the public. Don't hold back secrets. You know, be upfront with the public of like, this is what happened. We didn't see this gap for X amount of reasons. And the report should inform and be data-driven. Again, the recovery phase should be cross-sector. If it was a total disaster, this is an opportunity to rebuild in an efficient way and involve the community in how the rebuild should be. You know, post-disasters is a good chunk of money that is given to different locations, and we rebuild the same way that we built before. And, you know, people are given funds to rebuild their houses. Is this an opportunity to maybe educate the community or educate insurers? How can we build better? How can we learn about this and create codes and structures that can withstand the next? When I was working at Old Dominion Universities as a graduate student during my practicum, we had a cross-sector group that came together at the Center of Climate Change at ODU. And one of those members of the group came from the Realtor Association. Ocean View and the Willoughby Spit part of Norfolk, if you're not familiar with that, was created by a hurricane over 100 years ago and is very flood prone. And one of the recommendations that they gave and what ultimately became a code in new builds was that houses had to be built 6 feet above the ground. So now when you go to that area of Norfolk, you see a lot of houses that are elevated, especially around Willoughby Spit, which is, this little sand barrier that was created by a hurricane. So those are opportunities post-disaster to really move into the future. And like Sandra mentioned, don't look in the past. How can we improve opportunities of the future? And make economic development work for everybody, with equity at the forefront of that. So during the recovery phase, it's also really important for public health and environmental health because it's so long term. What if there are private wells that were contaminated? That's a space for environmental and public health to inform the public on how to protect themselves from waterborne diseases. Mold, black mold. When we reopen buildings, sometimes it's not obvious that we can see that mold. There are states that have what I like to call special zoning laws, and they sometimes may have a facility that can house a hazardous chemical next to a neighborhood. What if there's a flooding event and that gets spread across? What is the spread? What does that look like? Who is impacted? What are the health outcomes? The recovery phase, again, is another opportunity for public health and emergency management to work together under these HiAP strategies in order to better protect people on possible future health outcomes that they may not see or may not know. Next slide, please. So as I mentioned at the beginning of my section, we created an area of the plan where you have these partnerships. And I started with this first set of partnerships because these are kind of the ones that we don't always think about when we are working in emergency preparedness. Finance, again, your community banks, people who maybe can finance opportunities to rebuild. Also, charities in that finance that can also finance people to evacuate. People don't evacuate for a variety of different reasons. It's not always that stubborn person who doesn't want to leave their homes. They probably don't have the means to go stay at a hotel or to go drive. Is there a financial institution or a charity that can help with that in order to reduce loss of life? Education, so primary, secondary education, mental health providers, and academia. How can we inform our children on how to be prepared in a disaster? Is this an opportunity to infuse this in high school education? Is this an opportunity to maybe create volunteerships between higher levels of academics with primary education on how to better prepare yourself during a climate or any type of disaster? And then mental health providers. When disasters occur, sometimes shelters don't have these kinds of services or services needed for people with various needs. So knowing who your mental health providers, when there's a huge loss of death or when you have concurring disasters, that's when suicides increase. We saw with COVID a large increase of suicides among adolescents. And in Puerto Rico, where I am from, there was an increase in suicide after the hurricanes and the earthquakes, because I don't think what people remember is that we had Hurricane Maria, and within less than a year, there was a series of earthquakes that affected the southern part of the island, and then COVID. So mental health is really important. Again, your health and medical partners that some of us are aware of, your Medical Reserve Corps, your pharmacists. After a disaster happens, people need their medications. So it's really important to know what pharmacies are remaining open, who is open, who hasn't been impacted. And you can also use them as a form of relaying communication to? If you have your neighborhood pharmacist that stayed open, is that a way for you to distribute information to that community? Next slide, please. Your government entities, so your public housing, your first responder, your public officials, military, your regulator, your code enforcers. Again, these are really important partners to have when you're doing that mitigation phase and you're doing that preparedness phase. These are likely folks that are going to help in the response phase in trying to remove people from a hazard or get people to safety. So another important group of people that you need to already start building out relationships or have part of your work group. Next slide, please. And then another group of partners that I pulled out from the list, and this is not all of the partners that we suggested, I've just kind of pulled out a couple in other sectors, nuclear, radiological, and chemical. These are SMEs that you could probably use to help inform if an area has been impacted by something chemical or something biological. Your land use specialists can really help you out if there was a site, a brownfields, or another site that may have been heavily contaminated and may be flooded out. What is that impact going to look like for neighboring areas? Your engineers and your infrastructure specialists, your local real estate associations, what we're seeing in Hawaii with folks coming in and trying to do land grabs that happened here in Florida after the last hurricane, where a lot of people went to Fort Myers and started going to communities where there were trailer neighborhoods and communities that had very elderly folks living there and tried to do land grabs there. So work with your local real estate people in order to protect the community that has been there. And then historical preservation and business developers. Next slide.
Oops. It didn't show up for some reason, Christine, the resources that you put in. You want to just talk about them
sure,
for a minute?
I'll talk about the resources. So we can provide these hopefully in the chat. I'll put them in the chat. But they're URL links to various resources. One of them is a rural health information toolkit for emergency preparedness. And this can give you some information in rural communities. I also found an international emergency preparedness self-assessment tool. There was different tools that you could download. It comes from the European Union, but I think there's a lot of things that can be used here within the United States. The New York City Community Preparedness page, their resources, they have resources around mental health. So I saw that as a really great resource to share. And then ready.gov has a social media guide that gives you already templates on social media messages that I found really useful, because sometimes you don't know what to put out in social media. You have a really short turnaround, and already having a template to work off of is really great to have. So I'm going to share these in the chat box. And so hopefully it copies and pastes. And with that, are there any questions from the group?
I'm going to stop sharing so that we can actually have a conversation. So while folks think about what questions they might want to ask, I really was looking through the chat while we were going on, and I see that folks have some really great experience. Some work in preparedness, some are interested in preparedness. But I was interested in this comment that you made, Tatiana. If you want to unmute and tell me about this lens that you're describing, how some health officials at states really view themselves differently as not doing environmental health. Could you explain that a little bit?
Yes, thank you, Sandra. Great presentation. I appreciate Christine. I appreciate Sandra for the session. Very timely. We actually right now really wrestling with identifying specific strategies of that intersect between health policies and environmental health. There seems to be, maybe that's where I heard there's some sentiment that we just do environmental side. So we really think about identifying issues related to environmental, but we don't bridge into the health side. We're not trying to, understand how that impacts the health of the community, that we're trying to really work on the social determinants place. And this is what the public health does. And so that's one thing that we're trying to figure out what that means. But I also have a question kind of related to that. Another potential kind of consideration there is that we've been hearing that there is a regulatory framework, that some of the health and health policies, strategies or concepts might in a way conflict with the regulatory framework. And here's an example I want to provide. So if something is being permitted or licensed by the state agency, let's say it's a agricultural facility, and in the permit it says that it's okay to be quarter mile from the residence facility. So that's permit set up to protect health. And so then the health and policy strategy, if you do this impact assessment, will provide an evidence that it actually recommends to be 3 miles away to really protect health. So if the agency provides this information, it means that it conflicts what is set up in a permitting process, because permitting process has a less of the mileage. And so information like that seems to, at least folks think, it conflicts with how regulatory process can connect with health policies. That's what we're really struggling to reconcile right now and figure out what's possible. So I don't know if there is any, from the speakers or others' experience.
I think that's not uncommon, right? And sometimes it's a matter of timing, and we've already made this permitting decision, and the time for this HIA information was 2 years ago, right? Because the regulatory process isn't set up that way, right? And I think some of it too can be around what I was describing as that small p, right? That process, and how's your regulatory framework align? Right. I think that can create conflicts, and I think it can create frustration for communities, right? If you're doing this impact assessment and the data says that it should be 3 miles away, but the zoning, right, decision is for it to be a half a mile away, right? How do you reconcile that in your case at the state level, right? Or is that a community level decision?
And if I just want to add, in that, I think it also can put agency in a kind of this. They can see themselves being in a strange situation because, again, like the permits are set up to protect health and human health, and if then you come up and say information, well, for this it's actually this. So what does it mean in the context of how permits are set up? So again, I love the idea of the group. I think there's a lot of those nuances we'd like to kind of work out about, also on an organizational level. What can the roles be? Because I like that, like big P things, but there are also small P opportunities. So I would love some, connection on this and discussion.
Yeah, then we will definitely write you down for that work group, and I'm going to let Christine answer as well.
Yeah, I would also add just timing, maybe the needs assessment with how frequently they update their regulatory process, or maybe knowing how frequently they update their regulatory process. Maybe it's an every 2-year thing, maybe it's an every 3 year. So maybe timing the needs assessment with those updates could hopefully kind of reduce some of that conflict in the future. You're on mute, Sandra.
Sorry about that. Did you see other comments? I'm kind of scrolling through the, I don't see hands at the moment. But I think one of the things I think is really interesting, Christine, maybe you could talk about this a little bit more, is around you talked a little bit about facilities and cooling shelters. Could you talk about the different frames that you could use for different climate related disasters, for the different strategies? Because I think this is an emerging threat, and I think climate disasters look different in different parts of the country. But are there other tools? I know there's a wildfire guide, but are there other things that connect, that you know of that might be useful to the audience?
So I know, I think EPA has an environmental justice tool. And if I can find it while we're in this discussion phase, I'll try to put it in the chat. But it uses GIS mapping, and it kind of helps you identify what environmental justice impacts a community could be at risk for, with an overlapping map of climate impacts. So they have a bunch of different categories on the side. I've used it before because I reside here in Jacksonville. And Jacksonville, especially downtown area, there was a lot of old factories. And the St. Johns River, whether it's a tropical storm or heavy flooding, it does flood a lot of the area. And most of the areas that are impacted by that flooding tend to be Black, historical Black neighborhoods here in Jacksonville. So if Sandra could find it and she could put it in the chat. So the EPA tool is really great. NOAA is developing several tools with partners in South Florida around flooding. They did a great one here in Florida, but I think their tools extend outside of Florida. And again, it's GIS mapping where you can overlap, potential risks that you may be at. I want to say it includes agricultural risk, but I cannot remember. It's been a while since I've used it, and how that could overlap with either a fire or a flooding disaster. But I think there is still gaps when it comes to tools, and I'm glad that some of the folks have put those gaps in the chat. And I think one I saw was around heat in schools, and what happened at the start of the school year here, where schools were not, appropriately with adequate AC or had those measures to protect children in extreme heat. And these are things that policymakers and codes and maintenance is going to have to start looking at, is appropriately adding these things to schools, because it's going to continue getting hot, and it may be hotter for prolonged periods of time during the year. We kind of saw something similar actually during COVID, with the implementation of units to clean the air, and these HEPA filters and a variety of respiratory units that can be put into schools, opening windows. Some schools probably couldn't open windows to allow free flow air. So as we continue experiencing disasters, our old buildings, we need to start thinking through of how can we potentially modify them, because there may not be funds to build a new school. So how can we use our existing building and modify it for potential future climate situations, or another pandemic or another kind of disaster?
And I think the issue around schools is becoming more and more critical, right? I was talking to someone in Tacoma, Washington the other day, and they were saying that all the schools there didn't have air conditioning, right? That air conditioning was considered a privilege for a long time. And I think that that's changing. I have to say, that was a native Floridian. I don't think I want to live anywhere else without at least a window unit, right? Just because our climate's changing and it's getting worse. But I think thinking about it, from that kind of preparedness angle, and it's something that going all the way back to Andrew, that we had to deal with schools, right? Like, you can't keep people living in a school forever. So looking through the chat, and I see that Dr. McGee put in about mental health, right? And I think, especially with climate, the mental health is becoming so much more important that we respond to that, that we're able to provide more resources, because we're all dealing with this existential threat, right? It's always in the back of our mind, in our lizard brain, that's like making our fight or flight remain open. And it increases our overall mental readiness, but it's also when your fight or flight system is open, it's all of these emotions, right, that come to the surface very fast. And having part of our response plans respond to mental health, I think, is critical, as they do in New York. I mean, in New York, they're called the Department of Health and Mental Hygiene. And I see Dr. Silva's hand up. Raquel, would you like to unmute?
Oh. Hi. Thank you for taking my question. I was here thinking about typing it, and then I thought I may as well say it verbally, because I was thinking about this connection with schools that you were just mentioning, but also with other buildings. And since our topic is health in all policies, one thing that I keep thinking about is air quality as it relates to all of what we've been talking about. So say we're talking about air conditioning, we're thinking about energy on one hand, we're thinking about comfort and mental health and health outcomes in general, which are affected by heat. But there's also the air quality component and the synergistic adverse effects of not considering both heat, comfort, and their quality. And how, to me, this is the most important aspect of this health in all policies framework, is that if you're thinking about one issue, you're considering these other aspects. And if you do it in a coordinated fashion, it will likely be much less expensive, because we were talking funding, much less expensive than, oh, now we're thinking heat. Oh, and now there's wildfires, we're thinking air quality, and so and so. So if you would like to comment on that.
Do you want to go first, Christine? I saw you
Sure.
nodding.
I mean, I would even like to add infrastructure to that. Our grid system is incredibly old, and we want to add new systems. We want to be more renewable and efficient, but we haven't done anything to update the system. And some states, depending on where you are in the state, your energy might be coming from another state. And we saw that with Texas, where Texas, their energy extends past Texas. And when that cold snap happened, it could have caused a lot of problems for neighboring states too. So I would even, the infrastructure part also needs to be at the table with that, because if we're going to add more AC units to create better air quality, then we have to have a grid that can support that.
Yeah, I think that's true, right? And so there's this bigger net, right, as you mentioned, of not just partners, but also issues, right? And how do we bring that multimedia conversation, right, to the table whenever we're thinking about planning for disasters, when we're thinking about response, right? Making sure that we're doing this, right? Even as you think about health and all policies, right? Think about this cumulative impacts mindset of what's already happening in this community that might make them vulnerable, that might make them less able to respond, and how do we shore up those capabilities before the next disaster, right? How do we
just to add the health lens there, this issue of funding, the supporting those who are most vulnerable, for example, by justifying that some support is related to their health. So if you want them in a preventive way, so if you want them to be healthy, they need air conditioning so that they are not suffering kidney disease because of lack of air conditioning for reprieve at night. So that would mean that you were connecting also with the healthcare system in a way that I don't feel nowadays is yet there.
Yep, I think that's true. I want to make sure that if there are other questions, that we get to those as well. We have about 15 more minutes remaining in our time, and I'm not a fan of just, talking to keep talking. Let's see, but I see maybe a question that came in from Rena. The chat back open. What is a specific health policy that can, let's see, oh, did I lose it?
I got it, Sandra. What is the specific health policy that can be or has been applied to the Health and All Policy tool?
Well, I mentioned that we had done a lot of work around lead poisoning prevention, and we use that Health and All Policies lens. There are tools out there that were created to use a Health and All Policies lens towards health, lead poisoning prevention. Christine, you worked on that project. Do you want to talk a little bit about those resources as well?
It's been a long time.
It's been a couple years.
Yeah, it's been a couple years. Yes, so we did a couple of resources around that, and we also worked with AmChip on a coin in relation to that as well. And I think it may still be on the AmChip website. I am not sure when if the coin kept it, but we did like an environmental assessment tool on how to look at different aspects of lead. What was the point of contamination, legal resources. If Sandra or I find it, we'll put it in the chat. But that was one of the tools that we created through that project, was kind of like an environmental health. And it was made mostly for a community member to kind of look at their home and their work to see how the impacts of lead were affecting them or their children.
I've got it. I'll put it in the chat right now. So there's been several frameworks developed around using a Health and All Policies framework. So that's just one around lead poisoning prevention. The National Environmental Health Association has done some work around climate and Health and All Policies. I don't think that those case studies are up yet on their website, but this is an evolving area of applying Health and All Policy lens to different issue areas across, especially environmental health, because the funding for this tool came out of the National Center for Environmental Health at the CDC, which I should say and acknowledge the support of the center and specifically of Hope Rubel and the whole center staff at the Office of Policy there, and really supported this work and pushed this work forward. And we wouldn't have any of these tools if it wasn't for them. And so I'm not seeing other questions. So I just want to share like the last few slides that we have, and then we will close this out. So I really want to thank you all for joining today. This is a great group. We had a pretty robust conversation. Our next SOPHIA sponsored webinar is going to be on October 4th at the same time. And it's going to be with Dr. Benjamin Pauly of Kettering University. Kettering is located in Flint. And Dr. Pauly has actually written a book on including community narrative as part of impact assessment, right? And so making sure that when communities come in and for an HIA or for Health and All Policies meeting, and they say, this is our lived experience, that we don't come back at them and say, this is, well, here's what the data says, right? And what happened in Flint, and Ben's going to talk about this, what happened in Flint was the scientists, the HIA people from EPA told them their water was safe to drink. Right. And so what happens when there's that conflict between what the community is saying and what the data shows? So I hope you'll save the date for that conversation with Ben. And also for our online practitioner workshop, December 5 and 6, we're going to spend one whole day, one of our sessions is going to be talking about the skill sets and the research around the future of health and all policies. What do you need to do this work? What does the future of it look like? And we'll have our international speakers who are actually doing a huge project. It's researchers from New South Wales and from the UK, and they'll be talking about what they're finding in their research around the skills, knowledge, and ability that you need to do, HIA and HiAP. And then on the second day, we're really going to be digging into some tools. We have a new health and all policy screening guide, which our health and all policies work group has worked really hard on, that we're ready to launch. And we have some other tools that we're going to be talking about. So look for those save the dates. You can also find that on our website for SOPHIA. And you can join SOPHIA for the low price of $50 and become a part of our community so you get all of these updates. And this is our contact information. We are happy to have you. If you're interested in that work group conversation that I discussed, you can reach out to Christine or me, and we'd be happy to put you in the mix for that. But if you also just have questions or comments that you want to share with us outside of this forum, we're happy to connect with you in that way too. So thank you all so much. We're really, really happy that you were able to join us today and to spend so much time with us. Thank you so much. And thanks to Christine for being my guest.
Thank you, Sandra. And again, as well, thank you, everyone.
Take care.